Community health care centers around the state could close or deal with drastic cuts if a deal isn't reached in Congress by tomorrow. The government helps fund 72 of these clinics in Minnesota. And as Esme Murphy shows us, they help care for 180,000 people.
At a small clinic on Rice Street in St. Paul, Minnesotans are getting health care services, including dental, medical, and mental health care on a sliding fee scale.
She's excited to come here.
Juanita Moss works at the clinic. She, her 4 adult children, and a grandchild are also patients here.
This clinic to be in the neighborhood and in the area is very important. You know, I'm just heartbroken that we're going through this.
Minnesota's clinics need $26 million to keep them funded for another year. Clinics are not just in urban areas, but also throughout the state.
We are at the brink. The hard cutoff is the end of March. There is funding through the end of March.
Clinic representatives just returned from Washington, lobbying Congress for the clinic's survival. In a letter to Minnesota's congressional delegation urging a vote in favor of additional funding, Governor Mark Dayton wrote the uncertainty is wreaking havoc and that no Minnesotan should experience an interruption in their care as a result of a partisan disagreement. Juanita and managers here point out that it's not just patients here that will be affected. If community health care centers close, many patients will turn to already crowded local emergency rooms.
The emergency rooms are going to be overflowed with our patients trying to get medical help.
Now, late today, Senator Tina Smith released a statement saying the funding for community health care centers is in a compromised Senate budget bill that the Senate approved today in order to avoid a government shutdown. Details, though, still have to be worked out. And at this point, while it's a very good sign for these community health centers, I can tell you it's not a done deal.
All right. Thank you, Esme.